Okay, this video is called Diet Spectrum Comparisons to show you the spectrum of diets and how they compare to each other. So the most sort of obsessive narrow diet would be the Walter Kempner rice diet, from Durham, North Carolina. Kempner was very famous, considered by many to be the best doctor in the world of his time. The diet came out of him seeing that the Asian populations were quite healthy, and he had dramatic results. He had a patient as a fat black lady. He didn't have time to talk to her, and he said, come back in 2 weeks, only eat rice. She didn't come back for 2 months, and she had lost tons of weight. All her labs were dramatically improved. She was doing fantastic, and he's like, wow, this rice diet really works. He had trained with Otto Warburg in Germany, the great Nobel Prize biochemist, and he himself was a nephrologist as well as an internist. And he was really trying to take care of patients with severe hypertension and patients who were in kidney failure back in the day before there was dialysis. So one of the reasons why he had them on white rice is because first of all, the fat is super low. It's only 1% of calories from fat. And in addition, it was also quite low in protein. It's about 7 or 8% of calories from protein. One of the people who worked with him said the rice he was serving was 5% of calories from protein. So anyways, he wanted to lower protein because that's the workload for the kidney. The main thing the kidney does is excrete the nitrogen from protein. There's no nitrogen in carbohydrates or in fats. He gave him Uncle Ben's white rice. He had also given some fruits. And, he let him have some sugar, white sugar, for example. Dr. McDougall called the Kempner diet the diet for the nearly dead because it's rather boring and monotonous. And Kempner himself said this is not something people would want to choose on their own. And he made a lot of effort to dramatically reduce sodium, and he felt the patients needed to be in a monitored setting when they were following the strict version of his diet. And they would come to North Carolina and stay in these rice house apartments while they were supervised eating the diet, and he'd check their labs quite frequently. Okay, so that's the one most restrictive version of the diet. Another restrictive version of a vegan diet is the raw diet. And the joke mantra with this is raw is the law. There's a famous runner. They're both famous runners here. Michael Arnstein was this vegan, almost a fruitarian guy. And he moved to Hawaii so he could eat fruits all the time, have them conveniently available and cheap. Ruth Heidrich's also the famous lady who survived metastatic breast cancer here. She was a patient of Dr. McDougall. She said she became a vegan in 1 hour after talking to Dr. McDougall. They told her to make a will that she's only going to live a couple months, try chemo, etc. And she's like, I think I'm going to run a marathon and become a vegan. And she did. She's still alive over 40 years later. So anyways, it's hard to be a fruitarian, so to speak, unless you live somewhere tropical where the fruits are available all the time and cheaper. But they had relatively good results with it. Ruth Heidrich started out eating the McDougall diet for many years, and she gradually switched towards eating more of a raw diet because she found that convenient. Another version sort of the raw diet is raw till 4, which is a term that comes largely from Durian Ryder, Harley Johnstone. He's a guy who runs and who also rides bicycles in competition. He's a very entertaining guy. His videos are kind of funny. Typically he's talking and his girlfriend walks around in a bikini and he rants on and on. So it's kind of crazy, but it's also kind of entertaining. And he takes on a lot of famous nutrition experts who are BSing the public. And he's real smart. He's not an academic guy, but he's real smart. And he's kind of crazy, but he's entertaining. Freely the Banana Girl was his girlfriend. She's a very pretty lady who had been real fat. And she, went down this path of eating the plant foods, and she became very skinny. And a lot of people liked her. My daughter used to enjoy watching the Freely the Banana Girl videos. Garth Davis is a famous bariatric surgeon doctor. He wrote a very good book called Proteinaholic. And he's a little bit down this path. I don't even know exactly what diet he eats, but I heard him speak very positive about the fruitarian type diet eaters. Okay. Next is my version, and I talk a little more about my version because that's the one I'm most familiar with, the Peter Rogers diet. The main name for it was really the Spartan Vegan diet, and that came out of my background as being an athlete, a wrestler at Stanford. And also because it's very sparse. It's very cheap and simple. The only cooking I do is to boil starches, rice, beans, quinoa, oatmeal, potatoes, sweet potatoes. It also got called the medical monk diet because I wrote the book The Medical Reformation and dressed up and got a haircut like Martin Luther. Kind of crazy for drama. It was kind of fun, and also because too I'll talk about the importance of religion and science and medicine. And people tell me, oh, you don't need science and religion and medicine. I can assure you, you're wrong. Okay, I've been a doctor over 30 years. I grew up in a family of doctors. I'm around doctors all the time since I was a little kid, and I can assure you, the reason why medicine is a disaster these days, it's getting worse and worse, is because it has adopted a metaphysical philosophy of atheistic Darwinism. People don't understand what an insult that is. What atheistic Darwinism says, it says you're nothing but a talking monkey. All the patients have no soul, they're just talking monkeys. We don't owe them a damn thing except the standard of care. And then the standard of care is taken over by the big drug companies because in order to get promoted at the Ivy League and the big medical centers, they have to get grant money. And who's got the money? The big drug companies. So everything becomes centered around how can we make the big drug company happy so we can get some money from them. And then once the standard of care is put in place instead of optimal care, then it just becomes drug city, okay? And that's why I think artificial intelligence, AI medicine, is a big joke. It's going to be written by the drug companies, and it's going to tell everybody, give the patients more drugs, okay? It's going to be stupid. And that's why all the modern technology, all the modern research, all the gene editing, all this stuff is a bunch of BS. The patients get abused far worse than they ever did before, and they have terrible outcomes. They're fatter, sicker, and stupider than they ever were before, and it's only going to keep getting worse. Because if you don't care about the patient as an individual and believe they are created in the image of God and therefore somewhat special, and therefore the patient is the highest priority rather than money, they're always going to get screwed. They're always going to. It's guaranteed. If you look at coronary artery disease, you treat it with a low-fat vegan diet, you cure out virtually 100% of them, at least 99.4% of them based on the Esselstyn study, Journal of Family Practice, July 2014. You go down the path of stenting, you don't increase longevity, you get $30,000 for billing. You go open heart surgery, a cabbage, coronary artery bypass graft, you get $150,000. You're never, ever going to offer the low-fat vegan diet unless you say, we love the patient, we'll do what's right for them, we don't care if we make less money. And I guarantee you that it's impossible to say that in the modern world because of atheistic Darwinism and all kinds of other bad stuff. Basically, with atheistic Darwinism, whoever's got the power, the money, and the might forces their will on everyone else. And usually, whoever's got the power, money, and the might don't care about the low-life proles. And if you're listening to this video, then you're probably a low-life prole who Big Pharma considers just basically a useless eater and somebody who's wasting the resources of the world. So anyways, that's why do you think MAID has gotten so big? You know what MAID is? Medical assistance in dying, okay? That's what gets promoted with high tech. Basically, atheistic Darwinism is a metaphysical philosophy that leads to eugenics, okay? And eugenics is already here. People just don't realize it. Okay, the other nickname for this diet is bad boy veganism because I criticize a lot of the problems with toxicology. I think toxicology is something that, conventional medical training does not teach what I call NET, N-E-T, nutrition, epidemiology, and toxicology. You need epidemiology because it proves that low-fat vegan is so much by far the best, it's not even funny. There's really no competition for it. You need to know toxicology because there's tons of toxins in the modern food, side effects of drugs, in unfiltered tap water, even sprayed into the air. You need to know that, okay? And if you don't know that, then it's invisible to you and you can't avoid it. Okay, so what else? So that's why I got called bad boy veganism. The reason is most nutrition websites, health websites, they're scared to criticize almost anything that has commercial popularity or is accepted by the establishment because you can get shadow banned, for that. You can, diminish your views. No one will interview, almost no one will interview me. They'll say, oh, I'm a jerk. I'm a jerk because I tell the truth. As Plato said, that no one is more hated than he who tells the truth, all right? And that's what Voltaire also said. The most certain way to be persecuted is to speak about unpopular truths. So, but I sort of see that as that's my utility, so that's what I do. I don't monetize my channel, but I see that my channel needs to be there because there's so much BS information. I feel sorry for all these pros. These patients are pathetic. Typical patient I see is fat, sick, and stupid from eating processed food, okay? And you can't even fix them quite often because I often don't see them till they're about 55 and older, and they sort of lost their mental acuity, and they're just too too stupid. They don't have curiosity. They don't have zip and vigor anymore, and they're just not motivated enough to turn it around. The few who are can make dramatic improvement. Okay, what else? Whole foods, single ingredients, always only a single ingredient. Because as soon as you put a second ingredient, they can put contaminants in it that you don't want without even telling you, like MSG, MFG. No oil, not one drop. I agree with Caldwell Esselstyn on that one. No MSG, no MFG. Those are flavorants that make stuff taste good and you overeat it, but they're also brain excitotoxins. No soy. I think soy is just a chump food to sterilize low IQ people. None of this high fat nonsense. Nuts and seeds. I don't add any sodium. I recommend no added sodium. RO water. If somebody cooks for me, let's say grandma or my wife cooks for me, I'll eat it with a little bit of salt in there, but I never seek it out. And they usually don't add it. I tell them not to, but I can't always control them. And I don't want to cook for myself if I can avoid it. I'm pretty busy. Reverse osmosis water. No caffeine. Caffeine, it's a brain toxin. The older you get, the more fragile you get, the more problems related to it. It basically increases stress. Everybody says, oh, stress is bad for you. Well, then how could caffeine be good for you? Okay? Because you're going to hear a lot of BS artists. And one thing I think was funny, and I think he's a typical example. There's a guy by the name of Matthew Shepard or Matthew Walker. I think it might be Walker. And he's a nice guy, and he's pretty famous for talking about sleep and how to sleep better. And he sits there and tells people it's okay to have a little coffee or decaf. And you say to yourself, why would somebody say that? That's obviously ignorant and stupid and incorrect. The reason he says that, and I know the game of the internet, okay? I've posted over 2,000 videos. The way the internet works is if you tell unpopular truth, no one will interview you, people get pissed off at you. So even though he's a sleep expert and knows better, he has to say coffee and caffeine are okay because otherwise he wouldn't get interviewed. His business, that's his career. This is not my business. I do this as a hobby. I don't monetize my channel. I tell you that because you have to be that way if you're going to be able to speak out, I think, on a lot of the problems. Because you'll get demonetized, you'll get warnings, strikes, and all this other stuff. They won't let you make money on the internet if you tell the truth about stuff. It's just a fact. The more truth you tell, the less you'll be able to talk. And so you can go to other video channels, but there's not that many viewers there. This forum right here, this is YouTube, it has the biggest audience. So if you want access to the big audience, you have to shut your mouth about a lot of important things. Let's see, what else? I'm pretty big on reverse osmosis water, because there's tons of bad stuff in water. I got entirely separate videos about all that. I'm also a big proponent of toxicology. You got to watch out for these mitochondrial inhibitors and these SERCA inhibitors. SERCA is sarcoplasm, endoplasmic reticulum, calcium ATPase. It really is, the endoplasmic reticulum is a reservoir to store calcium in the cell. The sarcoplasm component just comes from muscle cells. And so if you can't store calcium in there, that you have a tendency to get overloaded with cytoplasm calcium, and that causes a lot of problems for cells: excitotoxicity, increased risk of apoptosis, programmed cell death. No alcohol, 0 is what I recommend. No MJ, it's all for idiots. Try to minimize your EMF. Now, my diet is what I actually follow myself, and it's what I recommend for people. And I realize hardly anybody's going to want to follow this, but it's what I recommend. It's what I think they should aspire to. It's good to know what ideal is and aspire to it, even if you can't, always reach it, or at least you know what to aim for. Now, the next category of diet, very similar to mine, is what I would call the Dr. McDougall diet. And the McDougall diet, I would also call the McDougall diet basically the California School of Nutrition. It's very popular and it's very good. This has led to more people being cured of chronic disease than any other diet in the world. This is also realistic. Mine is a little bit fanatical. Like my wife said to me one time, she said, "You're an effing robot. You would eat the grass if you thought it would make you healthy. No one else is going to do that." And that's fine. But anyways, the California School of Nutrition. And there's a lot of great famous nutrition people that follow this pattern. Chef AJ with her wonderful YouTube channel, she emphasizes no sulfas, no salt, oil, flour, or artificial sweeteners, no sugar, simple sugar. Alan Goldhamer, the famous doctor out at True North, where they do a lot of fasting, no salt, oil, sugar, okay. Doug Lyle, He's the famous psychologist that worked with Dr. McDougall. And the other thing they emphasize, they often like fasting as kind of a way to break the cycle of bad habits. And this guy Goldhamer recently wrote a book all about, can water fasting save your life, something like that. Jeff Nelson, he runs a great YouTube nutrition channel called Veg Source, and he actually went to True North with Goldhamer, and a fast he thought was very helpful and dramatically improved his blood labs, and they've been staying improved. Chef AJ also had tried the fasting stuff with Goldhamer, and that had been real helpful to her. So there's something to that. I've never done the fast routine. I eat OMAD, 1 meal a day diet, and I find that convenient. And my attitude's kind of like, I don't need to fast. I can control myself, make myself do whatever I want. And sooner or later, you got to eat food. But I can just tell you, I've seen a lot of positive stuff come out of that. So this basically is the California School of Nutrition. And I think this is the spot for like the typical average person to aim to. This would be the way to go. My way, I think, is a little bit better, but it requires a lot more reading and studying and effort. And most people aren't willing to do that. But this is something doable for everybody. McDougall says, you got to let people put a little bit of salt and sugar on their plant foods, or they're not going to eat them. The most important thing is to avoid the major poisons, which he says are oil and animal foods. So this also is a very low-fat diet. Oh, I should have put Nathan Pritkin on here. Nathan Pritkin is pretty much this school of nutrition. And they're very strongly low-fat. And the reason is, like Chef AJ, she couldn't lose the weight until she stopped eating nuts, for example. Another thing about it is when you look like where does McDougall and Pritkin place the blame for hypertension? They strongly emphasize the effect of high-fat diets to cause hypertension. They're also very atherogenic, and they also cause insulin resistance, meaning diabetes. So, McDougall is sort of a student, if you will, of Nathan Pritkin. Nathan Pritkin was a genius, okay? You read his books, you'll be amazed how smart that guy was. And he went through all the literature on fat, and Nathan Pritkin came to the conclusion fat is bad. And if you follow it, Dr. McDougall agrees with that. If you read McDougall's books, read them carefully, look at his references, look what he says. Fat is bad. Fat causes hypertension. Fat causes diabetes. Fat causes obesity. Dr. McDougall's quote is, the fat you eat is the fat you wear. Correct. He also says fat paralyzes the insulin receptor. Correct. Okay. Fat causes hypertension. Well, why is everybody so sick? The main reason is obesity, hypertension, and diabetes lead to atherosclerosis, which leads to heart disease, which leads to myocardial infarction, leads to congestive heart failure, and it leads to strokes, okay? And it leads to dementia. So it makes you fat, sick, and stupid, and most Americans over 55 are fat, sick, and stupid. So if you don't want to end up fat, sick, and stupid, you want to eat a low-fat, plant-based diet, okay? Now, I put Esselstyn's as being a little bit separate. The reason I think, I wrote Esselstyn's diet in greens. It's also a 100% vegan diet. But what's different about Esselstyn is he puts a lot more emphasis on eating more greens. Because he really likes greens because they contain a lot of nitrates. Nitrates are the precursor for making nitric oxide. And he emphasizes as we get older, we tend to produce less nitric oxide from our endothelial cells, the arterial lining cells. And so by eating greens, we can keep our nitric oxide levels up higher. Nitric oxide is the most powerful vasodilator to open up arteries. And his most important specialty clientele are patients who have had previous coronary artery events. So it's especially important for them to eat a lot of greens. Okay, he's pretty strict. No nuts, no oil, not one drop. Okay, so Esselstyn has the best results in the world of any doctor for treating coronary artery disease. It was like more than 30 times better than the optimized version, so-called optimized version of the Mediterranean diet in the Lyon study. Okay, so those are some big differences there. And I think the fundamental difference between, like, why do I put myself in a separate school than the California school or the Esselstyn school is, Dr. Esselstyn comes from a surgical background. He's sort of an endocrine, cancer surgeon. Dr. McDougall also was a surgical assistant all through med school, and he did internal medicine as his training. But in my opinion, they still have a view that the optimal, holy grail of health is clean coronary arteries, whereas mine is different. I'm a brain doctor primarily. I started out as a vascular interventionalist and imaging-guided surgeon, but then I became a neuroradiologist, and I had a sort of a biochemistry background. I almost went into becoming a biochemist. So I'm very interested in toxicology's effect on the brain, because I think even with clean coronaries, these toxins can, cause significant cognitive impairment. So I emphasize that stuff a lot more. Okay, and that's one of the reasons why I'm sort of a stickler on all this toxicology stuff. Okay, now let's look at the next group of vegans. I call this the moderate to fat level, even almost a high fat level. And there's a lot. I would say these are actually the most famous vegans. These are the most famous plant-based doctors in the world, and they are super popular, and they get far more views than all the rest of these people. I disagree with their philosophy of nutrition, but they'll typically promote soy. Most of these doctors here, not all of them, but most of them that I'm aware of. Whereas I think soy is a terrible food. It's like 40% of the calories from fat. That's a bad idea. It contains heme iron. You want to minimize your iron. Gosh, it increases insulin-like growth factor more than other plant foods, especially those isolated soy proteins. I think they're a bad idea. Non-organic soy will often be processed with hexane. It's a neurotoxin. Okay, soy affects both estrogen receptors, the alpha and the beta. So not only just the ones to prevent osteoporosis, but also the ones for premature puberty. It'll increase that. It affects the female reproductive system. It lowers male sperm counts. And I think soy was literally subsidized as a way to reduce the numbers of low IQ people. It's specifically there to make them infertile. Olive oil is sort of like, everybody loves olive oil. It's like the magic oil, and they love the ancient Greeks. And I got Greek friends who are pissed off at me because I criticize olive oil and the Mediterranean diet. But too bad, it's bad for arterial health. All oils make you fat, increase your likelihood of insulin resistance and diabetes. And I'm going to bet it suppresses the immune system, because in animal studies, all these high-fat foods tend to lead to that, from what I've read. You can look at the work of Lydia Lynch, for example, the immunologist lady over at Harvard. Okay, omega-3 fats. I think omega-3 fats are for chumps. Jeff Nelson at VegSource YouTube channel made great videos about the problems with omega-3s. I would not supplement with those. How well are they going to be purified? What about the risk of rancidity, increased prostate cancer, immune suppression, obesity? Forget about it, in my opinion. Okay, so these are like really famous nutrition doctors. Dr. Bernard, Dr. Campbell. All these guys are super famous. A million times more famous than I am. Dr. Greger, Ornish, Klaper, Kahn, Furman. Okay, these are like the biggest names in nutrition. But I think that, in my opinion, I think they allow too much fat in their dietary recommendations. I believe from my study of the literature that they don't. They will claim their study of the literature supports what they say. Okay, and they're smart guys, and they've studied a lot, and they know a lot, fine. But I think at a fundamental level, I think they're wrong. I think this high-fat approach is wrong, because my background was emphasis on vascular interventional radiology. I spent a lot of time studying atherosclerosis, and I can tell you the human digestive system and human physiology system, the blood system, blood flow, oxygen delivery systems, they don't like fat. They really don't like fat. And the mitochondria, they don't like fat. Okay? So I think this is a misguided approach. That's my opinion, based on a lot of study. Okay, fine. And also, by the way, the typical doctor who studies nutrition just sort of as a sideline, not an obsessive, compulsive, crazy fanatic like myself, but just who studies it as a little bit of a sideline, reads a few books on it, they will tend to come to this position. You'll see a lot of cardiologists who are in this field. This is actually where a lot of people are, okay? And I can tell you, I one time openly said I disagreed with Dr. Bernard's promotion of soy. I was kicked out of a Facebook group. A bunch of people said that I was a jerk. They then said Dr. Bernard is a saint, and who am I to ever criticize anything he says? And I'm like, okay, okay, fine. I know he's a really smart guy. He's done a lot of good things. He gives lots of good lectures. He's a real skinny, good-looking guy. He's written a lot of good books. He's a very bright guy, and he does know a lot, and he's said and done lots of good things. But when it comes to soy, I disagree with him. He is pretty good, though, I bet. I've read that in his books today where he said, well, only organic soy. Okay, so he does say that. I'll give him credit for that. Okay, let's see, what else? But he also says, in my opinion, in order to be popular with the public, you have to be kind of gentle. For example, like, why did I write vegan extremism over the McDougall diet? Because they try to slander you if you have a strong opinion. Dr. McDougall, if you go look him up in Wikipedia, Wikipedia says, nutrition experts accuse Dr. McDougall of vegan vegetarian extremism. He promotes an extreme form, because they know that the typical stupid person is very scared of the word extreme. Whereas I love it. Anybody who's great loves that word. You say, I want to be extremely smart, extremely strong, have extremely good endurance, okay? Anybody who runs a marathon or an ultra marathon like Arnstein and Heidrich, they have extremely good endurance, okay? They have extremely good energy, extremely good health. Okay, what's wrong with that word? But they know, the people who are experts in slandering people, they know that you use the word extreme and everyone gets frightened. So that's how they try to slander somebody. If you're a moron, they just say you're a moron. But if they know you're smart and you're up to something good, they'll just call you an extremist. So I'm just letting you know, that's how they scare everybody away from this. And it kind of has to be this way, because if the public ever widely became aware of like the California School of Nutrition here, the Dr. McDougall Diet, and these other experts on nutrition, they wouldn't have, obesity, hypertension, diabetes, coronary artery disease. You can't make money off them. There's no money comes out of low-fat, low-sodium vegans, okay? For example, I'm 60, I have zero medical problems, okay? People who eat this way, they don't get the common diseases, so you can't get them on pills, and then they don't get the complications of these diseases, which lead to surgery, so you can't make money off them. So big food and the big drug companies, they always want people eating as much fat as possible. Nathan Pritkin had very clearly said, the major difference between the diet categories is the amount of fat eaten, okay? And he strongly emphasized this low-fat stuff. So this would be kind of like your circle for most people. Raw diet, raw vegan and fruitarian stuff, I've never experimented with that just because the fruits are such a pain in the ass, to have to keep going to the store to buy them all the time. So I don't personally have the experience of ever having done 100% raw, okay? And nowadays they're spraying all kinds of stuff on the avocados and the apples, the AP, then the letters E, E, and L. So I want to avoid that stuff. Avoid it like the plague. Okay, let's see. Okay, next group is animal rights vegans. So animal rights vegans, the problem with their diet is they usually don't care that much about health, and they'll eat all kinds of health food, of high-fat foods. Like, potato chips are vegan food, but they're super high in fat. They're terrible for you. So they eat all kinds of junk food, and they're not healthy. They're just as sick as the meat eaters. Then there's the categories of lacto, ovo, pesco vegetarian. And I was actually lacto vegan for a while. I used to drink skim milk. But the more I learned about the problems with milk, like increased risk of prostate cancer, the more I'm like, I want to avoid that. Some people try to say pesco is good, the fish is good. Fish is not good. Fish is a terrible food. It's like the other meats. You want to avoid it, okay? Real acidic, super high fat. Salmon, for example, is 50% fat, 50% animal protein. That's a terrible food. I want my total fat below 10. Mine's probably around 5%. Of calories from fat. Okay, eggs are what you feed ovo. Eggs are what you feed, animals to cause atherosclerosis. It's a terrible food. Okay, the next category of diet would be, some doctors will call themselves flexitarians, which is a BS thing. That means you can kind of do whatever you want, but you try to eat more plants. Mediterranean diet is like one of the biggest lies. I made an entirely separate video about it, saying it's the antichrist of diets because it promises salvation but leads to people into health hell. And the Mediterranean diet is by far the most popular diet with all the big universities. And literally all these nutrition conferences that are run by famous nutrition places. For example, I went to one, I'm not even going to say the name, but all the famous university nutrition conferences I've ever seen promote the Mediterranean diet. And even a surprisingly high-fat version of it. They stink, okay? They're grossly incompetent. People should not respect conventional medical system. I'm sorry, but when it comes to nutrition, doctors don't know what they're talking about. They literally almost always give bad advice, okay? That's important to know because the typical stupid person thinks doctors know health. They don't. They don't know nutrition. They don't know epidemiology. They don't know toxicology. And they don't know basic pathophysiology because it's not in their textbooks. It's not in their boards exams. And therefore, they are incompetent. I'm sorry, but that's just the reality. When it comes to the chronic diseases, they don't know what they're talking about other than the rare few who've literally made an effort to study this stuff on their own time because they get no reimbursement or credit or reward or incentive for doing this. Okay, low carb, paleo, carnivore, Atkins, keto stuff is all totally stupid. This guy right here, Chris Palmer, he's a pretty famous psychiatrist out at Harvard. And I do think the guy means well. And he, he kind of became aware of keto diet. There was some young child whose father was a famous movie director, and the kid had refractory seizures, not responding to medicines, but then he responded well to keto diet. And I'm like, well, look at the point there. A hyperactive brain going into seizures. So you can effectively treat it in some cases by putting the patient on a high-fat diet because it slows the brain down. Does anybody, do you get that? I want my brain to be fast and smart, okay? Why would I eat a diet to slow my brain down, okay? If you had a seizure disorder, it would maybe perhaps be relevant in that case. But for a regular person, we want our brains to be fast. We want to be lively, vivacious, energetic, okay? And so the last thing I want to do is eat a diet that's going to slow my brain down, okay? And it was a miserable diet. There was like a syringe full of oil. I thought it was disgusting. And, Palmer, I think his heart was in the right place and he's trying, but he really doesn't know much. Okay, by the way, Harvard doctors say one stupid thing after another. I've gone through the Ivy League textbooks in numerous subjects, and I can assure you they're universally stupid. They stink. They're a disgrace. They're pathetic. A health coach who watches, my videos, Dr. McDougall's videos, all this stuff for a week will know more than the Harvard chief of a Harvard department in internal medicine subspecialties, because they have not studied nutrition, epidemiology, toxicology, nor do they know basic pathophysiology. The 1,700-page textbooks of neurology, of pathology, and the shorter books on cardiovascular pathophysiology, they all suck. They all suck because they don't include nutrition, epidemiology, and toxicology, and those are the three most important things. That's why I say the doctors in the Western world, they're poorly educated. Yeah, they studied physics, and they studied calculus, and they studied physical chemistry. So what? Those subjects are essentially irrelevant to health and medicine, okay? So anyways, that's a comparison of the diets. I hope you found that helpful.